Hola, ¿qué tal? Gracias por conectarse a esta sesión informativa de la Organización Panamericana de la Salud sobre la pandemia por COVID-19 en la región de las Américas, este miércoles 15 de septiembre. Soy Sebastián Oliel del Departamento de Comunicación de la OPS y esta sesión durará alrededor de una hora. Como cada semana, ya hemos recibido sus preguntas por correo electrónico y también podrán hacer preguntas a través del chat mediante el botón Q y A. Les pedimos siempre incluir su nombre y medio de comunicación al enviarnos sus preguntas. También les recuerdo que contamos con interpretación simultánea al inglés, portugués y francés y que pueden optar por cualquiera de ellas dando clic en el botón Interpretation. Hoy la directora de la OPS, la doctora Carissa Etienne, les informará sobre la evolución de la pandemia en las Américas y sobre la situación de los niños, niñas y adolescentes y la COVID-19. Acompañan a la doctora Etienne en la sesión de hoy el doctor Jarbas Barbosa, subdirector de la OPS, el doctor Ciro Ugarte, director de emergencias en salud de la OPS, y el doctor Silván Aldiguieri, gerente de incidente para COVID-19 en la OPS. Ahora sí, entonces quisiera invitar a la doctora Etienne a que nos comparta sus palabras y actualización regional. Doctora Etienne.
Thank you, Sebastian. Good day and welcome to this press briefing. Thank you for joining us. Over the last week, some 1.4 million cases and 23,300 COVID-related deaths were reported in our region. As many parts of the world are reporting a steady or decreasing number of cases, over the last week, the Americas reported a nearly 20% increase in new cases. In North America, infections have risen by a third due to surges in the United States and Canada. In the Canadian province of Alberta, COVID cases have doubled over the last week, and hospitals are experiencing a critical staff shortage. The US is reporting more than 100,000 new daily infections for the first time since January, and hospital capacity in many southern US states remains worryingly low. Infections are also surging in Costa Rica, Guatemala, and Belize, as many hospitals are completely saturated with COVID patients. Meanwhile, infections have slowed in the Caribbean, although there are a few notable exceptions. Grenada, Barbados, and Bermuda are reporting sharp jumps in cases, and Jamaica saw its highest weekly case count since the beginning of the pandemic. Most South American countries are seeing continuing declines in COVID infections and deaths. We are encouraged that more than 30% of the people in Latin America and the Caribbean have been fully vaccinated against COVID-19. But because these doses have not been equally distributed, there is still much to do to reach everyone who needs a vaccine. As we talk about inequality in our region, we should also talk about a group whose needs have not received the attention that they deserve. So today I want to provide an update on children and adolescents. We've learned a lot about this virus over the last year and a half, including about how children and teens can catch and spread COVID. When children get infected, they tend to have mild symptoms or none at all. But COVID-19 can cause severe illness in children and adolescents. As with adults, if children have underlying conditions like diabetes, or if they are overweight or obese, they are more likely to get infected and more likely to develop serious symptoms that require hospitalization. Younger children are less likely to pass the virus on to others, but risk goes up with age. And by the time they're older teens, young people are just as likely as adults to transmit the virus. Last year, there were over 1.5 million COVID-19 cases among children and adolescents reported in this region. 9 months into this year, infections among children and adolescents have reached over 1.9 million. As more adults receive their COVID-19 vaccines, children who are not yet eligible for vaccinations in most countries are representing a larger percentage of COVID hospitalizations and even deaths. So let's be clear. Children and young people also face a significant risk of disease from COVID-19. The pandemic is also affecting children's health in other ways. Kids across our region are missing out on annual checkups and routine vaccinations because of the widespread disruptions to health services. Half of young people have experienced increased stress or anxiety during the pandemic, yet mental health services and support remain out of the reach for many. Sexual and reproductive health services also remain disrupted across more than half of countries in the region, helping to fuel one of the largest jumps in teenage pregnancies that we've seen in more than a decade. Beyond the direct impact on their health, the virus indirectly has consequences and are hindering their growth and their development and jeopardizing their chances at a bright future. Lockdowns and economic disruptions have increased the risk of domestic violence, and for many kids, homes may not be a safe place. Our kids have missed more school days than children in any other region. And despite efforts to leverage virtual classrooms, these can never substitute in-person schooling because schools are not only places where children get an education, they are also places where children socialize and can receive mental health support or a nutritious meal. Each day that children go without in-person schooling, the higher the likelihood that they drop out and never return to school. For some of the most vulnerable children, particularly for our girls, this can have lasting consequences. Experts agree that the pandemic has triggered the worst educational crisis that we have ever seen in this region. The broad impact of the pandemic on children and adolescents cannot be ignored. And that's why we must protect children by giving them and their caregivers the support that they need to maintain the public health measures that have been proven effective against the virus. While COVID vaccines are not yet approved for children in most countries, practicing physical distancing, washing hands often, wearing masks in public, and avoiding crowded places can help keep children safe from the virus. Children and teens should get tested if they develop symptoms or if they suspect that they're sick to avoid the infection of others. Adults also play a role in keeping kids safe by themselves practicing these public health measures and getting vaccinated when it is their turn. Countries should also do everything that they can to safely reopen schools. There is no zero risk scenario. So national and local authorities should decide when it's time to open or close schools, depending on the local epidemiological situation and the capacity to respond. PAHO has developed detailed guidelines on the measures that are needed for school reopening, such as proper ventilation and sanitary conditions, and has published recommended measures to protect young people from COVID-19 infection. As vaccines become available, teachers and school staff should be prioritized for vaccines because adults are more likely to bring the virus into the classrooms. Now is the time for ministries of health, education, and social protection to work together and to design integrated policies that put children and families first. Countries like Chile, Uruguay, and Colombia have successful programs that incorporate education, health, and social services to meet the full needs of parents and children and to limit the consequences of the pandemic for their future. And finally, we urge countries to bring parents, children, and adolescents to the table. At the beginning of this pandemic, the virus was having a disproportionate impact on our elderly. And as a result, too many children and young people still do not think that they are at risk. And we must change that. It is important that children and teens understand their risk of getting sick and the role that they play in preventing COVID-19 transmission. Countries need to develop communication campaigns that are specifically directed for children and adolescents and that bring their needs and their resources available to them in focus, listening to their concerns and their parents' needs, and using language that they understand in platforms that they like TV and social media, platforms that resonate with them. Today, children and teens across our region are at risk of becoming the generation that missed out on the health, education, and social opportunities that they needed to reach their fullest potential. But it's not too late to address this. Countries must act urgently now to restore health, education, and social services to minimize the impact of this pandemic so no child or teen is left behind, because their future is ours too.
Muchas gracias, doctora Etienne. Vamos a pasar ahora a responder las preguntas que ya nos han enviado por correo electrónico y también tomaremos preguntas que nos están enviando por el QIA. Recuerden identificarse con su nombre y medio de comunicación al enviar su pregunta. La primera pregunta que tenemos es de Jacqueline Villeda, de Diario del Mundo en El Salvador. Dice si es recomendado por la OMS o OPS la vacunación en menores de 12 años. ¿Qué opinión tienen al respecto como OPS de que países como El Salvador habiliten la vacunación para niños entre los 6 y 11 años? ¿Y cuáles son las recomendaciones que hacemos al sistema de salud en torno a esa decisión? Y también en el chat, Nora Gámez del Miami Herald dice que Cuba comenzó a vacunar a los niños de 2 años esta semana, si podríamos comentar sobre esa decisión también, y si hay información, data que apoye el uso de vacunas en niños pequeños. Doctor Barbosa.
Gracias por las preguntas. Siempre hay mucho interés en las vacunas para niños, niñas y adolescentes. Então, déjame primero muy brevemente aclarar cómo es el proceso de las recomendaciones de la OMS. Primero, las vacunas tienen que presentar para la OMS los datos que apoyan la información sobre seguridad y eficacia de sus vacunas para niños y adolescentes. En ese momento, de las vacunas que ya tienen la autorización de uso de emergencia, solo la vacuna de Pfizer tiene la autorización de uso para adolescentes. La vacuna de Moderna ha solicitado a la OMS la revisión de sus datos para utilizar en adolescentes de los 12 a los 15 años. Las vacunas de Sinopharm y Sinovac solicitaron también a la OMS que puedan utilizar las vacunas de los 3 a los 17 años. Essas 3 solicitudes todavía estão bajo análisis. Não se ha completado. ¿Por quê? Porque se tem que revisar de maneira muito cuidadosa as informações que apresentam os produtores sobre os ensaios clínicos que hicieron com adolescentes e niños para assegurar que são vacunas que se podem utilizar nesse grupo. Então, são vacunas que já estão autorizadas, lá de Moderna a partir de los 16, as outras duas a partir de los 18, pero todavia está pendente a análise de los dados para autorizar nesses outros grupos. Então, depois que se tem essa autorização, o grupo de expertos em vacunação de la OMS, SAGE, por sua sigla em inglês, hace a recomendação de uso. Ou seja, a vacuna está autorizada e se deve utilizar nesta idade, com essas características, etc. Então, todavia, hoje, não há vacunas autorizadas por la OMS para a utilização em niños e por isso a OPF e a OMS não recomendam todavia o uso dessas vacunas nesse grupo. Há países que estão sendo decisões e é uma decisão de cada país. Há 2 países que já utilizam vacunas em niños em la região, de la informação que temos, Cuba e Chile já utilizam. Seguro que Cuba e Chile têm suas autoridades regulatórias, receberam os dossiês, as informações de los produtores, las revisaram e las autorizaram. Não tem que justificar para a OMS ou para a OPF. Essa é uma decisão de cada país. Nós outros não podemos fazer comentário sobre essas decisões porque não conhecemos os dados que foram apresentados. Pero de nossa parte, esta é a situação geral de las vacunas. E creio que é muito importante também subrayar que muitos de los países da região, todavia, como nossa diretora subrayou bastante, estão com a necessidade de ampliar a vacunação em los grupos mais vulneráveis, que são os adultos maiores, as pessoas com enfermidades crônicas e depois seguir vacunando a todos os adultos. Essa, sem dúvida, é a grande prioridade que todavia tem a grande maioria de los países de América Latina e del Caribe nesse momento. Gracias.
Gracias, doctor. Próximas preguntas en el chat en inglés. Belisa Godinho de W Magazine dice, What advice does WHO PAHO give to children starting school? Y Sarah Sparks, an education journalist, pregunta, How has Delta changed the dynamic of school-based COVID-19 outbreaks? There are some models suggesting the majority of children under 12 could become infected by the end of the year without significantly tighter mitigation efforts. Are we at a point where we will be unable to control COVID-19 among children? Dr. Ugarte?
Thank you for those very important questions. We know that children of all ages can become infected and can spread the virus to others. Outbreaks of COVID-19 has been reported in schools, in summer camps and daycare centers, particularly when neither physical distancing nor masks were used to reduce the risk. So children and adolescents generally present a milder symptoms of COVID-19 disease, although infection with the variants, including Delta variant, require more investigation to determine if this will remain the case and what is the extension of the implication of this variant regarding to the clinical situation of the infected children. We know that the risk of transmission to and from children and adolescents depend on contextual factors, several factors, for example, the community transmission, the measures implemented to control the virus in the area where they live and where the schools are, host factors from the child themselves, and as well as biological factors related to the virus. So the use of public health measures and social measures, including physical distancing, hand hygiene, use of masks, coughing into the bend of the elbow or using a tissue, adequate ventilation in indoor settings are the measures that have proved to be effective to reduce the transmission. These measures should be consistently and appropriately implemented at all times for all children in schools, especially since children under the age of 12 years are generally not yet eligible for vaccination. There is a big responsibility of the national authorities, the health authorities, and the school authorities to implement these measures and to monitor the situation of the epidemiologic situation in those areas, but also implement those measures during transportation to and from schools. And then we will probably reduce the risk as much as possible, and we will not see this increase in children transmission that we are seeing, unfortunately, in greater proportions around the world. Thank you.
Muchas gracias, doctor. Próxima pregunta es de Lisette Escobar de El Universo en Ecuador, y similar también pregunta en el chat a Daniel Politi del New York Times. ¿A qué se debe la caída de casos de COVID-19 en América del Sur? Doctor Aldilleri.
Gracias por esa pregunta y voy a responder en castellano. Primero, es muy importante siempre recordar que desde el inicio de la pandemia observamos un mosaico de perfiles epidemiológicos diferentes entre las subregiones en las Américas, entre el Caribe, América Central, América del Norte y América del Sur. Creemos que esa situación de caída de nuevos casos en América del Sur se debe a una combinación de varios factores. Primero, los importantes picos de transmisión que ocurrieron en América del Sur durante el primer trimestre 2021 y luego, a partir del mes de junio, generaron la imposición de medidas estrictas de salud pública en varios países, en particular en las zonas geográficas en donde había un incremento de la transmisión. Y eso ha generado menos movilidad y menos mezcla social, quiere decir, impactando en la transmisión. Podría también existir algún factor asociado a la estacionalidad. Las curvas epidemiológicas de influenza, de gripe, entre 2014 y 2019 para América del Sur tienen un comportamiento similar a la COVID-19 entre 2020 y 2021, lo cual nos hace pensar en esto. Pero es importante notar que esa caída en América del Sur no es un efecto dado por falta de testeo de laboratorio. Se ha mantenido la vigilancia de laboratorio acorde a los casos y a las tendencias. Y como otro factor, es también muy importante tomar en cuenta los aspectos inmunitarios en la población. Primero, el efecto de la vacunación en Sudamérica, con más de 231 millones de personas con primera dosis, más de 132 millones de personas con un esquema completo de 2 vacunas y casi 9 millones de personas con una vacuna que recibieron una vacuna de dosis única. Adicionalmente, países como Chile, como Uruguay, tienen una muy buena cobertura nacional, arriba del 60 o 70%. Otros países están subiendo rápidamente su cobertura de vacunación, tal como Ecuador, Argentina y Brasil, entre otros, y con una cobertura arriba del 30% y que sigue creciendo. Finalmente, yo diría que se necesita más caracterización país por país sobre el efecto del número de recuperados de infección en una subregión que había sido azotada por picos importantes al inicio del año 2021. Espero haber respondido a la pregunta de los periodistas. Gracias.
Gracias, doctor. La siguiente pregunta es de Ana Lucía Ola, de Prensa Libre en Guatemala. Dice, con la variante Delta presente, ¿qué tan efectiva es la vacuna contra COVID-19 en niños y adolescentes? ¿La protección que brinda la vacuna ante la posibilidad de tener enfermedad grave podría ser mayor a la que tienen los adultos? Doctor Barbosa.
Gracias por la pregunta, Ana Lúcia. Ana Lúcia, não temos dados para contestar se a efetividade das vacunas são a mesma, maiores ou menores em niños e adolescentes, porque como falei, todavia se está bajo uma revisão da OMS a solicitud de los produtores para ter a autorização de uso de emergência de suas vacunas nesta população, nesse grupo poblacional. Então, quando apresentam essas informações, se vai poder verificar como essas vacunas, qual é sua performance, qual é sua eficácia no grupo de niños e adolescentes. Como podemos verificar a eficácia de uma vacuna em las variantes? Primeiro, se durante o período do ensaio clínico de fase 3, em los países onde se utilizou a vacuna para o ensaio clínico, estava presente a variante Delta. Aí vamos a ter uma informação que vai brindar os fabricantes. A outra possibilidade é, com dados da vida real, de uso já em los programas, e aí se pode verificar se a efetividade de uma vacuna sigue mantendo sua capacidade de proteção quando a variante Delta está circulando. São estudos, por exemplo, que foram divulgados já para os adultos, e é importante subrayar que mesmo para a variante Delta e em países como Reino Unido, há dados muito consistentes também em Estados Unidos, países que estavam já com uma transmissão muito forte da variante Delta, que as vacunas que têm a autorização de uso da OMS mantiveram sua capacidade de proteger para casos graves, para as hospitalizações e para as defunções. Ou seja, pode haver uma pequena redução da capacidade de proteção para formas leves, pero para as formas graves, para as hospitalizações e para salvar as vidas, as vacunas autorizadas por a OMS seguem com uma proteção muito importante mesmo para a variante Delta. Gracias por la pregunta.
Gracias, doctor. Tenemos preguntas de periodistas de Nicaragua, Cintia Torres de Confidencial, Uriel Velázquez de Despacho 505 y Karen Díaz del diario La Prensa. Diferentes preguntas. En general, voy a leer una de ellas. Nicaragua vive un rebrote de COVID que, según médicos, ya ha superado la primera ola de contagios. Sin embargo, dice, ni el gobierno ni el Ministerio de Salud han oficializado el número de casos y se continúa promoviendo aglomeraciones. Pregunta si hay alguna forma de proyectar cuándo los casos disminuirán, si el país no detiene las aglomeraciones y reporta casi 100 nuevos contagios a diario. Otras preguntas tienen que ver con la vacunación, la situación con los tanques de oxígeno y también la situación en hospitales. Doctor Ugarte, ¿podría contestar?
Sí, muchas gracias por todas esas preguntas. Una vez más, reiteramos que con los datos oficiales que tenemos de Nicaragua, no es posible hacer un análisis adecuado de la situación de la COVID-19 en el país. En ausencia de datos oficiales que permitan hacer un análisis adecuado, existen otras fuentes que muestran que hay una ocupación alta de los servicios de salud, en particular de los hospitales. Eso también hay reportes sobre alta transmisión, es decir, un aumento del número de casos, y también aumento en los niños y adolescentes, tanto en hospitalizaciones, en reporte de casos sospechosos y confirmados, y también de fallecimientos. Todo esto muestra una tendencia que también se está presentando en otros países, así es que no es sorprendente. Claramente, la aglomeración de personas brinda una alta oportunidad para que el virus se transmita de persona a persona. Así que en estas condiciones, en estas circunstancias, nuevamente hacemos un llamado a que la población tome las precauciones que correspondan, eviten aglomeraciones, mantengan la distancia física, el distanciamiento físico en todo momento, usen la mascarilla cuando estén cerca a otras personas y no puedan mantener la distancia física, ejerzan la higiene respiratoria, higiene de manos, y cuando tengan sospecha de contacto, implementen cuarentena. Y si es que son sospechosos de tener una enfermedad vinculada a la COVID-19 o con síntomas de COVID-19, implementen el aislamiento. Es una responsabilidad de todos. Es responsabilidad de los gobiernos de informar a la población cuál es la situación de la epidemia para que la población tome las acciones necesarias. Y es responsabilidad de cada uno de los pobladores asumir esa responsabilidad y cuidarse a sí mismos y a sus familias. De tal manera que en este proceso esperemos que mientras se incremente la vacunación en Nicaragua, que todavía está en niveles muy bajos, mantengamos las medidas de protección y, como anunció nuestra directora en anteriores oportunidades, sigamos cuidándonos para controlar la COVID-19. Gracias.
Gracias, doctor. Siguiente pregunta de Melina Ochoa de 1TV en México. Dice que de acuerdo con la Secretaría de Salud de México, desde que se reabrieron las escuelas hace 2 semanas, no ha repuntado la epidemia de COVID-19 en menores de edad. Pregunta si OPS coincide con estos datos de la no existencia de un rebrote por el regreso a las aulas. También quiere saber si OPS de reducción de casos de COVID-19 y de muertes en los 32 estados del país, y cuál es el estado actual de la circulación de variantes en México. Doctor Aldiguieri.
Sí, gracias por la pregunta de México. Es importante valorar la situación en escuelas en el contexto de la situación epidemiológica a nivel federal o en los estados. En este aspecto de situación epidemiológica se observa una baja en la gran mayoría de los estados, pero sigue con un número elevado de casos nuevos, un número superior a 10,000 nuevos casos diarios. La letalidad sigue elevada a nivel federal, con alrededor de 1,000 defunciones diarias, con una tasa de mortalidad acumulada de 2,100 por millón de habitantes. Otro aspecto importante es la variante de preocupación Delta, que es presente de manera mayoritaria en todos los estados. 92% a nivel del país, a nivel federal, y hasta al 95% en el Distrito Federal, según los datos de la Red Nacional coordinada por el INDRE. Este perfil es parecido a los demás países de América del Norte cuanto a la circulación de Delta. En cuanto a los aspectos escolares, el regreso a clases ha provocado algunos casos en alumnos y personal escolar, con hasta la fecha un cierre limitado de escuelas. Sin embargo, yo diría que podría ser muy temprano para sacar conclusiones cuanto a este aspecto de la dinámica de la pandemia en México. Y quisiera agregar que en este contexto es importante tomar en cuenta el anuncio por las autoridades de salud a nivel federal de la vacunación cercana para el grupo de entre 11 y 17 años. Y finalmente quisiera añadir algo y destacar que para el feriado largo del Día de la Independencia, a partir de mañana, existe, como en situaciones parecidas de movimiento de población, un riesgo elevado de reactivación de la transmisión y, por lo tanto, la necesidad de reforzar la implementación estricta de las medidas preventivas no farmacológicas. Espero haber respondido a las preguntas de la periodista, agregando este último tema importante. Gracias.
Gracias, doctor. Próxima pregunta para la directora de OPS en inglés. Can you give us an update on where vaccination stands in the Americas?
Well, thank you, Sebastian. And thank you for that question as well. So while vaccination campaigns continue to be hampered by delays in vaccine production, many countries in our region received important shipments over the last week. So more than 4.6 million doses arrived in our region, including donations from Spain, the United States, and Canada to several countries like Colombia, Costa Rica, Guatemala, Honduras, Jamaica. Countries continue to administer these vaccines. We have reached a new milestone in vaccination coverage. More than 30% of people in Latin America and the Caribbean have now been fully vaccinated against COVID-19. Indeed, several countries have already vaccinated more than half of their eligible populations. But we also know that coverage remains much lower in many countries. Just over 5% of people have been vaccinated in Jamaica, fewer than 4% in Nicaragua, and less than 1% in Haiti. And from what we can see, vaccine inequity is only getting worse. See, while some countries struggle to get enough doses to protect health workers and their priority populations, more than 3.5 million booster shots have already been administered in our region. Some for immunocompromised persons, but in several countries, some for the general population. While there is scientific debate on the utility of booster vaccines for people other than the immunocompromised, our priority now must be to use all the available vaccines to protect more people in our region. Because 30% of our population is not enough. These doses could help protect many people, many more people at risk. And we continue to urge countries with excess doses, both countries within and outside of our region, to please share these with countries in need, where they can have life-saving impact. I also want to take this opportunity to urge countries that have faced slow vaccine rollouts, like Haiti, to please redouble your efforts and expand the reach of your immunization drives, even in difficult conditions. Some countries, including several in the Caribbean, are also grappling with doubts about vaccines in their population, vaccine hesitancy. But to these populations, I say, please, take the vaccine as soon as it is available to you. The vaccines that have been approved by WHO are safe and could save your life. Don't hesitate to protect yourself and your loved ones from severe disease or death. Thanks.
Thank you, Dr. Etienne. Próxima pregunta es de Kevin Feldman de Guardian Media en Trinidad y Tobago. Dice en inglés, given that COVID-19 vaccines have lesser effectiveness against the Delta variant, are vaccine developers working on newer or stronger vaccines to help combat the Delta variant? If so, what does PAHO know about the status of those vaccines? Dr. Barbosa?
Thank you, Kevin, for this question. First, let me highlight again that the vaccines that have the emergency use listing authorization from WHO, with the data that we have, they are proving to be effective against the Delta variant. All the data that you have, and these are data from real life use in the United Kingdom and here in the US with the Moderna and Pfizer vaccine, in the UK with AstraZeneca and Pfizer vaccine, are showing that these vaccines can have a reduction in their protection for mild cases, but they are still effective and very effective to protect against severe cases, hospitalizations, and death. What this data are also showing is that you need to be protected by the 2 doses. Because if you have only 1 dose, and if Delta variant is the most common transmission, the protection is really very low. So it's important to highlight this because we needed to get more people vaccinated. This is the real protection that all of us have against the Delta variant. It's not to wait for a new vaccine, another vaccine that will come in 1 year, 2 years, or 3 years. The vaccines that we have now are effective against Delta variant. Of course, that all the producers are developing studies to improve their vaccines, maybe trying to get one-dose vaccine or a vaccine that combine the SARS-CoV-2 and the influenza virus. So we have more than 100 developers that are trying to get new vaccines against COVID-19. We don't know when they will be available. Maybe it will take 6 months, 1 year, 2 years. So don't think twice. Take the vaccine now. They will protect you against all the variants that are circulating. They can save your life, the life of your family. Thank you.
Gracias, doctor. Tenemos varias preguntas vinculadas con variantes, también de Kevin Feldman del Guardian, de Linda Straker de Now Grenada y también de Ana Herrero del Washington Post. Kevin, en inglés, pregunta, can you give an update about the spread of the Delta and Mu variants in the Caribbean? Has there been any more countries detecting these variants in the past week? And is there community transmission occurring? Linda Straker, similar, dice, what variants are found in the Eastern Caribbean states? And Ana Herrero del Washington Post pregunta, do you know if the Delta variant is predominating infections in South America? Dr. Aldiguieri?
Thank you for this series of questions regarding the Caribbean and also South America. So I will answer these questions and different moments. Regarding the Caribbean and mostly the Eastern Caribbean, different variants have been co-circulating in the Eastern Caribbean countries and territories, including the 4 variants of concern, of course, in different proportions. While Beta has been detected only in Antigua and Barbuda, the Alpha variant has been detected in Anguilla, Antigua, British Virgin Islands, Dominica, Grenada, Montserrat, and St. Lucia. The Gamma variant has been detected in Antigua, British Virgin Islands, Montserrat, and St. Vincent and the Grenadines. The Delta variant, which is becoming predominant in the Caribbean sub-region, has been reported in most of the Eastern Caribbean region, and during the last 2 weeks has been also detected in other parts of the Caribbean, including the Bahamas, Guyana, and Haiti. But it is important to remember that this process of displacement and or replacement of strains of variants by another is an expected phenomenon, which has been happening since very early in the pandemic and occurs, among other factors, because of the emergence and circulation of variants like Delta that are better adapted to the human host as part of their evolution process. Regarding the Mu variant, first, I would like to remind the public that this variant, originally classified as B1621, is not a new emerging variant. In fact, it has been circulating in the region of the Americas at least since January 2021. In the region of the Americas, this variant predominates in Colombia, and a significant transmission has been observed also in Costa Rica and in Ecuador, but with no impact in terms of severity, lethality, or significant increase in transmission. Other countries have detected the Mu variant on a sporadic manner with low impact on the community transmission. This includes Mexico, Chile, Peru, Venezuela, and a number of other countries, including in the Caribbean. It is important to mention regarding mu variant that it is a variant of interest. It does not generate, in essence, any change and does not suppose a threat or a particular risk after circulating for several months. It means that mu should continue to be closely monitored while new studies are carried out. And finally, the last question regarding the situation of Delta in South America. We can say that we see at the moment a difference with other subregions, including North America and the Caribbean, regarding the situation of Delta. Delta has been detected in all Spanish and Portuguese-speaking countries of South America. However, in many countries, we see that the Gamma variant, which emerged late 2020 in the Amazon basin, is still the predominant variant in many countries. So this is a complex mosaic, this is a complex panorama, but we are getting excellent data from the network of genomic surveillance in South America and also in other subregions as the Caribbean and Central America. I hope I have answered the concerns of the 3 journalists regarding situation of variants in different subregions. Thank you.
Gracias, doctor. Próxima pregunta de Gerson Collave del Comercio en Perú. Dice, hace poco la OPS anunció la plataforma para producir en el futuro vacunas ARN en la región. Pregunta si ya hay países que han mostrado su interés en participar y si Perú es uno de ellos. Doctor Barbosa.
Gracias por la pregunta. Es una iniciativa muy importante de la OPS que foi anunciada por nossa diretora para diminuir a vulnerabilidade que tem a América Latina e o Caribe. Miramos desde o princípio da pandemia para produtos relativamente simples, como mascarillas, como todos os equipos de proteção personal, depois para os ventiladores, respiradores, ou seja, há uma necessidade muito importante que foi subrayada agora no tema das vacunas, de fortalecer a capacidade de produção em América Latina e o Caribe. O princípio dessa iniciativa da OPS não é fortalecer a capacidade aislada de um país para produzir para sua população, é buscar uma produção compartida entre países, porque já temos em muitos países de nossa região a capacidade de produzir vacunas, a capacidade de produzir componentes importantes para as vacunas, e a ideia é exatamente aproveitar a capacidade que já existe, apresentar propostas que possam ser factíveis, que possam ter sustentabilidade ao longo do tempo. Não é um projeto para um mês ou 2 meses, esse é um projeto de mediano e largo prazo que pode ter uma repercussão muito positiva. E todos os produtos que se vão a desenvolver bajo esta iniciativa têm que beneficiar a toda a região. Tem que ser para todos os países de América Latina e do Caribe, utilizando os 2 fundos que tem a OPS, o Fundo Estratégico para Medicamentos e o Fundo Estratégico para Vacunas, de maneira que cada um dos países de América Latina e do Caribe possam ter um acesso melhor a produtos de qualidade e com preço adequado. Assim que lançamos a plataforma, a chamada, tivemos 32 propostas que foram apresentadas. Não posso anunciar agora se há propostas de Peru, porque as propostas estão todavia abaixo da análise final e vão ser anunciadas na próxima semana. Pero, de novo, Peru, assim como todos os países, vão ser beneficiados por la iniciativa. Muchas gracias.
Gracias, doctor. Y Gerson del Comercio también dice que Perú se encuentra en un claro descenso de casos y que se espera una tercera ola para este mes. Dice que pese a ello, las autoridades levantan cada vez más las restricciones y pregunta si esto podría terminar siendo contraproducente. Doctor Aldiguieri.
Sí, gracias por esa pregunta del comercio. Efectivamente, desde el mes de abril, Perú está reportando un claro descenso de sus nuevos casos. Además, el avance de la vacunación completa en los grupos subjetivos, junto con el mantenimiento de medidas de salud pública, tal como uso de mascarilla, distanciamiento social y otras medidas, deben acompañar el proceso de reapertura social y económica. Eso contribuirá a demorar la llegada de un potencial tercer pico o reducir su impacto cuando se presente. Pero lo que quisiera destacar, que es importante saber que las autoridades de salud de los países de la región, de América del Sur y de Perú en particular, tienen a su disposición instrumentos de monitoreo y modelización que permiten detectar de manera temprana un incremento de las tendencias a nivel nacional y a nivel subnacional. En este contexto, la articulación estrecha entre los equipos de vigilancia epidemiológica y los tomadores de decisión, gobiernos locales o gobiernos nacionales, pueden tomar decisiones bien orientadas cuanto a implementación o reforzamiento de medidas de salud pública que son clave para mitigar el impacto de la pandemia en la sociedad. Espero haber respondido a la pregunta del periodista. Gracias.
Gracias, doctor. Emilia Wexler de Clarín en Argentina dice, ¿qué es lo que Rusia tiene que presentar para que la OMS apruebe la vacuna Sputnik V? Puntualmente dice, ¿en qué falla Rusia y no solucionó para que le den vía libre a su vacuna? Doctor Barbosa.
Gracias por la pregunta. Todo produtor de vacuna que quiere recibir la autorización de uso de emergencia de la OMS tiene que enviar las informaciones para tres aspectos. Primero, la calidad de la fabricación. O sea, tiene que comprobar que el sitio o los sitios donde se fabrica la vacuna están de acuerdo con los estándares de las buenas prácticas de fabricación. Segundo, los dados de seguridad de la vacuna y los dados de eficacia. ¿Qué pasa con el proceso de autorización de uso de emergencia para la vacuna Sputnik? Es que el proceso está suspendido, ¿no? Porque durante la inspección de una de las fábricas que hace parte de la producción de la vacuna Sputnik, no se ha encontrado que esta fábrica está de acuerdo con las buenas prácticas de fabricación. Entonces, el productor tiene que tomar las medidas, hacer los cambios necesarios y solicitar una nueva inspección. La OMS está aguardando entonces que el productor pueda comunicar a la OMS que está listo para recibir otra inspección. Hasta que lo haga, el proceso se queda ahí suspendido, aguardando esa información del productor.
Gracias, doctor. La siguiente pregunta es de Orville Williams de Antigua Observer. En inglés dice, how far are we from a possible approval recommendation of use of AstraZeneca vaccine in children, considering AstraZeneca is the most accessible and widely used vaccine in poorer countries especially? Doctor Barbosa. Doctor, lo escuchamos ahora.
Sorry, there was can you repeat please, Sebastian? I had a problem here.
Ok, no hay problema. De Orville Williams de Antigua Observer dice en inglés, how far are we from a possible approval recommendation of use of AstraZeneca vaccine in children, considering AstraZeneca is the most accessible and widely used vaccine in poorer countries especially?
Okay, thank you for this question. As I mentioned, I think that one of the first or the second question that I answered, the producers needed to make this request to WHO. So the producers that have presented the request to receive the authorization from WHO to use their vaccines on children were Sinovac, Sinopharm, and Moderna, and they are still under review. AstraZeneca so far has not presented this request to WHO. I cannot anticipate when AstraZeneca will present. AstraZeneca is a very important producer of vaccine, and you are right, it's a very affordable vaccine, but this needs to be an initiative from the producer, because the producer is developing clinical trials to have a good information about the safety and the efficacy of this vaccine in children and adolescents. They need to complete these studies before presenting the request to WHO. So probably AstraZeneca is still performing these clinical trials because they haven't presented the request yet. Thank you for the question.
Muchas gracias, doctor. Y la siguiente pregunta en inglés dice, what is the current situation in Haiti 1 month after the earthquake? Doctora Etienne.
So thank you again for this question. We can't afford to forget Haiti. So it has been a month since Haiti was struck by the 7.2 earthquake that devastated the southern peninsula and also greatly affected the health sector. So in addition to some 12,700 injured persons and the 2,246 deaths, Haiti has 62 damaged health facilities, including 28 facilities that are severely damaged. 5 of those have been structurally assessed with the support of an engineer from our Smart Safe Hospital initiative, and others are on the list. We urgently need to repair the ones that can be repaired and to reconstruct the ones that suffered severe damages so that we can ensure a continuity of services in those areas. Of course, the emergency phase is over, so now we are entering the reconstruction phase. And PAHO continues to work alongside the Ministry of Health of Haiti to address what are some of the most urgent needs. To support the response efforts of the national health authorities, PAHO has deployed teams composed of 11 technical experts to support with things like coordination, data management, logistics, epidemiological surveillance, laboratory, water and sanitation and hygiene, obstetrics, psychosocial support, and health services. So these PAHO teams work side by side with the Department of Health Directorates in offices that were set up in 3 affected departments, and that was set up by us. We are also distributing medicines, medical supplies, including trauma and orthopedic kits to health facilities, both in the affected departments and in health facilities in Port-au-Prince, because those facilities supported the treatment of victims from the earthquake. Haiti is today being supported by 11 international emergency medical teams, or what we refer to as EMTs, that are deployed in the affected departments, many of them working really close to what were facilities before, but now are damaged. And many international and local partners have deployed mobile clinics to the affected areas. 6 other EMTs have now completed their missions and have left Haiti. But, you know, regrettably, there are still secluded areas that have not been reached. Primary health services must be reestablished in all areas where health facilities were damaged to ensure that the population can receive health services close to their place of residence. Big efforts are being made as we speak to strengthen the epidemiological surveillance, mainly for COVID-19, but also for other transmissible diseases, both in health facilities and in assembly points, where some 26,000 people who lost their homes are gathered. Health promotion activities encourage the population to follow the public health measures that we've spoken about so much and to get vaccinated against COVID-19 and other vaccine-preventable diseases. I must say that the current security situation is hampering humanitarian efforts, and blockage of the main road leading to the Southern Peninsula is delaying the distribution of aid to the affected departments. Fuel shortages as well also hinder activities throughout the country. So UN agencies and partners, we are continuing to use helicopters, convoys, and maritime transport to provide support and humanitarian aid to the affected areas. But that is making our work more difficult. I also want to make a special plea to Haitian officials and partners. Please, let's work together to intensify COVID-19 vaccination efforts. So far, Haiti has administered some 52,000 vaccines, and many more people need to be vaccinated. 1% of your population covered with an available 500,000 doses is totally unacceptable. Along with other measures, increasing vaccine uptake is important to protect the country from COVID-19 transmission. Please let us not forget Haiti in a time of acute need. Thank you. And thanks for joining today's press briefing.
Muchas gracias, doctora Etienne. Ahora sí, entonces hemos llegado al final de nuestra sesión de hoy. Queríamos informarles que la próxima semana no tendremos esta sesión de prensa porque se estará realizando el Consejo Directivo de la OPS, que comienza el lunes a las 9 de la mañana, hora de Washington, y que reúne a los ministros de salud de la región para abordar prioridades de salud de las Américas. Será realizado en forma virtual y estén pendientes porque les estaremos enviando un aviso con más información para que puedan seguir las sesiones, así como comunicados sobre las resoluciones más importantes y acerca de un informe sobre la pandemia que se presentará también a los ministros, entre otras cosas. También les cuento que las sesiones podrán seguirse en el canal de YouTube de OPS y en nuestras redes sociales, así que nuevamente estén atentos que les vamos a estar enviando más información al respecto. Y sobre COVID-19, recuerden que pueden consultar nuestra página web de la OPS, donde pueden encontrar más información sobre la situación epidemiológica, así como también sobre las vacunas y sobre el trabajo que está haciendo la OPS para contrarrestar los efectos de la pandemia. Así que, bueno, muchas gracias nuevamente por conectarse y seguimos conectados. Saludos.